people would like to know more about vaginoplasty. In just a few short minutes, can you tell our folks what that involves, what it is that you do, and how it is that we get people to that point?
When we say vaginoplasty, we're really talking about 6 or 7 different procedures. And we group them all into vaginoplasty because that's convenient, everyone kind of understands it. The goal of the surgery is to alter the male anatomy and use the existing tissue to create a female anatomy that is aesthetic, so it looks good, and it is functional. It does what it's supposed to do. So with that in mind, vaginoplasty involves penectomy, which is removal of the penile tissue, while saving the penile skin, and we'll talk about that later. Clitoroplasty, which is resculpting the head of the penis, which is the glans, and repurposing it and making it into a neoclitoris, positioning it where it belongs in a woman. Urethroplasty, which is cutting back the male urethra, locating it where it should belong on a woman's body. Labiaplasty, which is formation of inner lips, outer lips, removal of the testicles, which is the orchiectomy, removal of the excess scrotal tissue, which is scrotectomy. And then finally, the last step, not necessarily during the operation, but the last component of it is creation of the vaginal canal itself. That is where the differences in various techniques kind of arise. One can choose not to have a vaginal canal, so have everything else externally done, but not to have a vaginal canal, and that's called a zero depth, a shallow depth vaginoplasty. Some people call it a vulvoplasty more accurately. One can choose to have the vaginal canal created and lined with penile and scrotal skin, the skin that we had preserved initially, and that is the penile inversion vaginoplasty, which is the most commonly performed vaginoplasty currently. And then the new kid on the block is the peritoneal vaginoplasty, which is we create a vaginal canal, but instead of using penile skin, we use peritoneal tissue, which is the inside lining of the abdomen, to line the vaginal canal. Typically, 5 to 6 day hospital stay. If we are doing robotic assisted vaginoplasty, which is what peritoneal vaginoplasty entails, then we have more than one surgical team operating at the same time, maximize efficiency, play off each other's strengths, and so on and so forth.